Okay, we're continuing with the I Will Give You Back Your Health book by Dr. Day. This is part number 4. We're going to be talking about sleep. She says that before artificial light was invented, the light bulb, Thomas Edison, people slept an average of 9 hours at night. Then after artificial light became available, but before television, people average sleep dropped to 8 hours. And then nowadays, with all the distractions from the internet and cell phones, social media, she said average sleep time is 7 hours or less. Young people tend to sleep a little longer than old people. Men, as they get older, get a big prostate. They often have to wake up, and that disrupts their sleep somewhat. She said night shift workers frequently sleep no more than 5 hours in a day, which is really bad. Night shift work is a bad thing. They should get paid more because they're at increased risk for cancer and all kinds of problems. Okay. Human growth hormone keeps your skin supple and youthful. It maintains bone density, increases muscle mass. Human growth hormone is released especially during the early hours of sleep, the first couple of hours of sleep. And it's better to go to sleep at 10 o'clock at night and then wake up at 6 a.m. than it is to do the 8 hours from midnight to 8 a.m. I've heard that from other people too. I'm not completely sure that's true, but I've heard that repeatedly. So it might be true, maybe. Best to stop eating 2 to 3 hours before you go to bed because she says this increases your insulin, and elevated insulin will decrease your human growth hormone. Okay. She says good to have laughter when you can. That increases human growth hormone. You should not drink any caffeine. That interferes with sleep. The bro science people will lie to you and tell you, 3 cups of coffee is okay. That's BS. You want 0 coffee. It decreases the depth of your sleep, even if you seem to be in bed as just as long. They have to say coffee's okay, because otherwise they wouldn't get invited to the bro science channels. People like Matthew Walker, he's a smart guy, he means well, but he has to say coffee's okay or he won't get invited. That's how the game works. Okay, thyroid function can be decreased by MSG, monosodium glutamate, manufacturer-free glutamate, aspartame, cow's milk, fluoride, or chlorine. So she mentions all those things in her book. I would add there's more things that can be damaging to your fluoride. Having leaky gut, then you can get the autoimmune disease, molecular mimicry, autoantibody cross-reactivity. We've talked about that many times. I have other lectures entirely on the thyroid. Other foods, besides having leaky gut, you can get the same effect by having leaky gingiva, from poor dentition. The bacteria can get across your mouth and get into your blood. The bacterial endotoxins, LPS from gram-negatives, LTA from gram-positives. Soy is goitrogenic. It's best to not eat any soy. Guess what? Flax is also goitrogenic. Cruciferous vegetables are a little bit goitrogenic, especially if you don't cook them. If you cook them, they're less so. Aluminum in tap water can be harmful to the thyroid. Okay. Some of these estrogenic chemicals are harmful to the thyroid. Most estrogenic chemicals are also neurotoxic. Try to finish eating, she says, by 6:30 p.m. Now, that's difficult to do for most people. I don't even get home by that a lot of times, okay? Best to go to bed by 9:30 p.m. and then be asleep by 10 p.m. and sleep till 6 a.m. Okay, so in a perfect world, I'm also going to tell you something about Lorraine Day, okay? She's really smart, but, after she had metastatic cancer, she had a wealthy husband who could support her, so she didn't have to work. So it's easy to go to bed on time if you're not coming home late from work and you don't have to wake up early to go to work in the morning. So she did have some advantages, okay? She earned those advantages, certainly, but she did have them. But if possible, in a perfect world, you can try to do all these things. Go to bed by 9:30 a.m., try to sleep from 10 p.m. to 6 a.m. I can also tell you, Sade Stanchik, she's the lady who wrote the book What's Missing in Medicine, who had multiple sclerosis. She herself said the same thing. She said in order for her to feel good the next day, she had to get to bed around something like 9:30 p.m. and get all her sleep. That was always a top priority for her to be functional the next day, was getting to bed early. So I would add a few things that'll help you sleep. Avoid blue light at night. Try to get sunlight in the morning to set your circadian rhythms. You can buy these little tiny lamps with small bulbs. I like to put them on the floor because when the light comes from above, your body senses it more as being like sunlight. Then when it comes from the ground, it senses it more as being like fire. A lot more blue in sunlight than in fire. And your body just handles it better. It's less likely to suppress your melatonin production. You can use these blue blocker sunglasses. They should have a yellow tint on them. If they got a yellow tint on them, they're more likely to have a real effect and significantly drop your blue light exposure into your eye, into your retina. Use low watt bulbs at night, put them on the floor. So anyways, that's Lorraine Day's comments, her recommendations on getting sleep